Thank you for this opportunity. Great pleasure being in this room full of innovators, inventors, entrepreneurs, and investors. Keep up your great efforts to co-create a healthier and happier tomorrow for everyone, all of us. At FruitVaccine, our efforts to make that happen is by making the natural plants create our vaccines to be administered in the most natural way possible. We are born to eat and breathe, right? So we use oral and nasal routes, that is mucosal routes, to attack mucosal viruses such as respiratory infections. I'll start with a short video.
FruitVaccine is a startup company based out of the University of Illinois Research Park. Not only are we fighting respiratory diseases like HRSV by developing vaccines, we're paving the way in medical technology by innovating chewable pills, edible pastes, and oral drops that vaccinate mucosally, as well as seeds that grow into natural vaccine plants. So why choose our products over the traditional syringe? Here's what CEO and founder Indu had to say.
This fruit-based vaccine is very environmentally friendly, minimizes a lot of disposables used in injectable vaccines. People who are allergic to eggs can use our vaccine with no problem, and is vegan friendly at the same time. It actually also minimizes the contamination issues associated with injectable vaccines.
We most recently accepted a grant of over $270,000 from the National Science Foundation. Along with the grant, we honed our mission and plan by attending NSF's Business Boot Camp, all SBIR Innovation Core program, and Dawnbreaker training.
We are very happy to introduce our product to you and make you healthier and healthier every day. Yeah, more information can be found in our website, fruitvaccine.org. So during our customer discovery, we did during our ICO and boot camp trainings funded by NSF, we found out that about 25% of age-independent population is afraid of needles. When you take children, that exceeds 50%. And also, we are a business-to-business company, so we sell to healthcare providers who told us 70%, 74%, almost 75% of them said an oral vaccine will improve their workflow efficiency and customer compliance. And our initial customers, as we enter the market, independent farmers alone will bring $104 million of dollar savings by eliminating needle fear with our technology. As I mentioned, we are a mucosal delivery company, vaccine company, and we target respiratory diseases, and our first target is RSV, human respiratory syncytial virus. And we grow our vaccine plants in greenhouses so that we can keep our quality control properly. And our NSF-funded pill, FruitVax pill, it's a gummy-like pill, we expect that to increase the accessibility and acceptability of vaccines, because we expect that to be viable, storable at room temperature, so that cold chain requirement will be tremendously minimized. Our patented production technology involves transferring the immune triggering gene of the virus, engineer that to the plant, so the natural plant will become the factory of vaccines. And the plant parts, like fruits, will become the vaccine, and the seeds will be the reproducing agent, minimizing transportation costs tremendously. And our products include the NSF-funded FruitVax pill, chewable pill, oral drop, nasal spray, FruitVax puree.
That's time. Thank you.
Thank you.
Judges' questions. So, great job. And I think my question, I'm sure maybe you've gotten is, does it work? What have you done from a proof of concept perspective or testing perspective to show that this would be a viable alternative?
Right. We are a preclinical, I couldn't go to those slides. We are a preclinical company, R&D company right now, and we have tested our product. We have transferred the gene to the plant and tested our product with rodents. Like that's how we do preclinical testing, and that we have proven that. And we just submit, about a month ago, we submitted our NSF phase 2 and also NIST SBIR grants. And we are seeking investor funding. Current goal is to raise $2 million, preferably safe.
How do you control the dosing? And how does it compare to the tolerance of manufactured vaccines?
Right, so that's a great question. Dosing is a key requirement with vaccines. So that's why we are not using the whole fruit. Otherwise, you can use the whole fruit, which cannot be dosed. So we puree and freeze dry that, which will reduce about 95% of water from the product. That's how we increase the shelf life, and also it's storable at room temperature due to that. And so that we can quantitate that, we homogenize it and quantitate, and then make the pill.
Indu, maybe I'm missing this, but anything that is orally ingested, especially something that looks like food, how does it overcome the GI situation, SIP, everything that's happening that is intended to destroy and extract? So what's happening?
Yeah, that's a great question too. There's a certain portion of degradation happening also, but as long as epitopes are active, we are good to go. And our pill particularly is a chewable pill. So even before getting to the intestines, our oral receptors also can be activated with that chewable part of it. And like people who cannot swallow things, like they can dissolve, chew it into things like small kids, they can dissolve it in liquids and have it as well. And there are oral vaccines like cholera vaccine, even polio, and typhoid. The system works. Oral administration works.
Can you talk about cost of goods and how this compares to traditional vaccine manufacturing?
Right, so we are a very new revolutionary manufacturing technology. So instead of building needles, building lab requirements, we are growing plants. So our system will introduce greenhouse growers, pill makers, freeze dryers, and that kind of new businesses into the system. But the distribution system and all that, we will use the currently existing system to distribute. And also, if any vaccine to be delivered with e-commerce, it's going to be ours,
I think
with the pill.
this is where I'm unfamiliar. So is that whole system growing plants, will that be cheaper than manufacturing them?
It's our technology is going to be a lot cheaper. Because once we develop the technology, developing technology takes a bit of time and probably even cost. But once it is developed, it's very low cost production.
And how scalable is that? And
Extremely highly scalable, because our seeds will be the distribution, reproductive distribution system. And it's so easy to distribute at very low cost and grow the plants. And we plan to produce the vaccines locally so that we can develop the trust we can give jobs and develop the trust among the local people as well. They can be involved in the vaccine production system. So we can have vaccine producing units at local areas.
How do you build trust with providers, with physicians? And you mentioned it could be eco-friendly, allergy safe, vegan, but how do you convince a provider that this could be good for their patients.
Right. So we are going to inform all the providers. As we already had customer discoveries, they all were very happy with our product. They said if there's a product like that, we are going to be very happy.
That's time. Thank you very much.